Torticollis can be a stressful and troubling diagnosis for parents. It sometimes leads to never-ending battles to work on getting things not only back on track structurally, but also with their child's overall development. Now, as pediatric chiropractors, we specialize in the care of these common infant challenges. And the one thing that we can also tell you is this: so many of them are missed by the average pediatrician. I'm Dr. Joe Schneiderbauer, a pediatric chiropractor, and with my many years of experience, I've seen tons of kids with torticollis and plagiocephaly, and I'm here to offer help. So in this video, we'll cover the 4 main things that you need to know about torticollis and plagiocephaly, including how to find out if your child has these challenges and then what you can do to help. But before we dig right in, please, I ask that you share this with other moms and parents who you know need to hear this message. Now with that, the rapid and significant rise in birth intervention and birth trauma, we see more and more cases of torticollis every year. And unfortunately, for most parents, traditional medicine has not updated their understanding of what's causing it and how to best take care of it for some time, leaving most families, like Mateo's family, with only traditional treatment options like physical therapy that don't really get to the root cause of the problem. Now, Mateo's torticollis was affecting his quality of life in many different ways. And he struggled to hit milestones. He felt stiff. He was unconsolable, locked up most of the time, GI issues like reflux. And on top of that, he wouldn't go to sleep easily, nor would he stay asleep, leaving the whole family exhausted. His mom was desperate to find help and relief for her baby because his occupational therapy wasn't doing the trick at the time. Now, while she was researching one night, Mateo's rock star mom stumbled upon pediatric chiropractic care. Fortunately, there seems to be this shift happening in this generation of parents who are seeking pediatric chiropractic care more often and earlier than ever before. These parents and families are seeing incredible results with more gentle, effective, and long-lasting approach to their child's torticollis. How does torticollis happen, and what's the root cause? Well, torticollis is diagnosed medically as congenital if it's caused by abnormal positioning of the fetus while still in the womb, which is more common with things such as breech positioning and lowered amniotic fluid. The most common form of torticollis is acquired. The most common cause is birth trauma. The amount of physical strain, tension, pulling placed on the baby's head and neck during birth interventions like forceps delivery, vacuum extraction like Mateo experienced, and C-section are significant and many times leaves the child with significant subluxations that contributes then to the torticollis. Okay, so what are the subluxation? It has 3 main components. The first one, misalignment and abnormal positioning of the spinal vertebra. Number 2, fixation and reduced range of motion in the segment of the region of the subluxation. And number 3 is a neurologic interference or imbalance caused by reduced amounts of proprioception and increased amounts of nociception to the brain. Okay, so simply put, the more severe and apparent the torticollis and related misalignment and fixation, the more severe the subluxation patterns are for the child. Okay, so that's the first main point. Let's go to number 2. Why are mild or even moderate cases of torticollis completely missed by the pediatrician? Well, the first thing we'd encourage parents to do is if they're concerned their child may have torticollis, is not just relying on their pediatrician or medical doctor's exam findings. Now, of course, pediatricians are trained to perform physical exams. That's number 1. Number 2, why are mild and even moderate cases of torticollis completely missed by pediatricians? Well, the first thing we'd encourage parents to do is if they're concerned that their child may have torticollis, is not just relying on the pediatrician or medical doctor's exam findings. While of course pediatricians are trained to perform physical exams in a way to spot neuromuscular challenges like torticollis, still they don't have nearly the experience or detailed training in those systems as a pediatric chiropractor or a physical therapist would. Now, if the pediatrician does spot torticollis for a child, they'll most likely make a referral to a PT, who then will show the parents a few positioning and stretching exercises that they can then do at home and try to alleviate the torticollis. But most parents actually report to us that those stretches and exercises are extremely painful for their child and almost tend to aggravate the condition because it leaves the child in a sustained state of fight or flight tension, causing something known as dysautonomia. Now that's number 2. Here's main point number 3 that I want to really talk about. Traditional treatment options such as physical therapy and helmets don't always get to the true root cause of the neurologic component that we were talking about here. This is why parents routinely report that when they put pediatric chiropractic as the foundation and first choice of their child's torticollis, it then makes all the physical therapy, stretches, positioning work easier and way more effective. Now, as a PX doc, we love nothing more than working together with your child's therapy team for maximum results. The pediatric chiropractic approach to caring for torticollis is often the one parents feel makes the most sense. And it's summarized into 3 simple and safe steps. 1, find and locate the exact severity of the subluxations. Number 2, make safe, gentle neural tonal adjustments to relieve the tension and remove subluxations. And then number 3, encourage parents to watch closely for that reoccurrence of torticollis around the ages of growth spurts, teething, colds, illnesses, or other stressful events that a child may experience. Pediatric chiropractic looks deeper than any other practitioner, using insight scans to really find and locate the exact stress and the dysfunction of that neuromuscular system. Now, one of the real keys to caring for torticollis is not just positioning and range of motion testing as the only clinical criteria to solve or resolving this condition. As pediatric chiropractors, we routinely examine and evaluate kids ages 5 and up who had torticollis as an infant, did traditional medical and therapy treatments only, and still have retained torticollis all these years later. That's easily found on our exam and insight scans. That's our neurologic evaluation. These insight scans are gentle and effective in getting to the root cause of the problem and only take about 3 minutes to do each of the 3 tests. In many cases, I tell you, parents can start to see results and see their child experiencing relief in just a few visits. And overall, it generally takes a few weeks or even a few months to get full resolution of this torticollis. Now, before we get started, we'll sit down with you in what's called the report of findings visit to show and discuss your child's exact personalized care plan of how long it will take and what it all entails. There's no cookie cutter approach to torticollis where each child gets the same stretches and positioning exercises. The examination and the scans, the process that we do is crucial to making sure that we can find the exact root cause of your child's challenges and make just the right adjustment to get things taken care of. 1 month into Mateo's care plan, his digestive issues and eczema cleared up. And in 2 months, when his mom saw an absolutely huge difference, his mobility improved drastically. He started hitting milestones and said goodbye to the sleepless nights that the whole family was experiencing. So if your mom and dad gut is telling you there is more going on than your pediatrician or therapist can fully explain or address, then neurologically focused chiropractic care is perfect for you. We specialize in diving deeper and doing more through an assessment than anyone else out there, and work together with therapists after making sure we get to the root cause of the torticollis. We love the questions that you've been asking, so please keep them coming in the form of comments and DMs. The second thing I ask is that you found this helpful. Please share it with other parents, families, and Facebook groups who you know need to hear this. And if you want to learn more, we're always here to help. Please click and read the associated article that we have or go to our website.